we have basically two questions that we'd like to use for this breakout session. The first question is, what challenges, what concerns do you have about speaker meetings and inmate participation if you were able to actually, bring NA into your facility? That is the first question.
Well, I would probably just say, coming in with contraband and or like cell phones.
Okay, well, that's understandable. Bringing contraband in to a facility is something I believe that all facilities continue to have to face and a challenge with, regardless of who it is that's coming into the facility. But, during this time of the COVID crisis, a lot of things are being done virtually. Are there any concerns that you might have regarding speaker meetings on a virtual platform and inmate participation?
I think it's new. It would be something that even as, facilitators and someone who, has more knowledge and experience in the field, it's uncomfortable, right? So when you're sharing something in depth, I think for the guys, it might be a challenge at first as they adjust to this format. So I think that might pose as a challenge that we might see or encounter at first, but I also feel that's something that will, won't be lasting. I think for us, it's just like, I know that we're not going to get technology in the housing units. With the restriction of having to keep people separate with social distancing, it's going to definitely impact the numbers, even when we do go virtual and following that, when we're able to go back to later on. Even when we do go back to in-person meetings, I think that's going to be a challenge that we're going to have to deal with, here on out.
Anybody else have any concerns or challenges that might be different than, bringing technology into a facility that has specific restrictions and addressing the COVID policies required by the public health departments in your locales regarding social distancing and group gatherings?
I think one of the things that's coming up, and we did talk to Mark T, who's been having some current conversations about bringing in meetings, is the audio option to bring in either pre-recorded meetings or to just bring in telephone meetings. So I think that at this point, and actually our next presentation next Friday, we have presenters on the panel that are pre-recording step meetings and then being able to play those out into the institutions. So, I mean, I guess at this point, we're really hoping that one of the reasons we had this breakout session, we were hoping that you guys would be able to share any of the challenges, concerns, ways that we can further help. I mean, I know that the COVID portion is new, but I think the ability to use virtual and audio presentations going forward is something that is going to be up-ramped. So, and then if you're still not, I guess, ready to talk about that, can you just tell us about the ways, what was working and what wasn't working with Narcotics Anonymous currently, so we can kind of get a handle on that?
We really haven't been holding any meetings because we're not allowed to have visitors come in. And prior to that, I had a total of probably 80 people coming in a small facility. That's rather good. Mm-hmm. And a lot of them just sat and listened, and then, we would give out paper keychains for them, and everybody would come up for them that they shared. It worked really well before the COVID. I went from 80 people in my group to about 17 right now, as that will probably dwindle also as people leave and nobody's coming in.
Now, one of the things I was aware of is that they're also moving to either video visits that people have, like there's some kind of capability right now for virtual visits. Is there any kind of like iPad program there? Is there like a speaker system where they could hear something? I mean, what is kind of the inventory of capability right now? Because obviously we're not going to be putting 80 people in a room.
Right. No, ma'am, we have nothing, no capability of that at all as of yet.
All those things are in the works. Like I know here in Connecticut, we've had discussions about getting tablets for our population. We've piloted it at one facility, but it hasn't gone, throughout the different facilities within the state. And also the virtual visits are coming online, and we expect them hopefully within the next few months. Construction's being done for that with the, like I said, the connections for the electronics. But we're not there yet. So we're all kind of in this, limbo period where we're just waiting for these options to become available that we hopefully can utilize for these meetings, but nothing at this point. I did receive a few of the DVDs or the meetings that you mentioned earlier, and that's something that we are hoping to be able to place within the housing units, where we do have a TV, DVD situation where all the guys in that housing unit can listen. If they don't want to go out in the day room to watch, they can at least listen from their bunk areas. So we're hoping to do that and maybe distribute it to different dorms to give everyone the opportunity if they choose to participate.
Well, yeah, that's actually exactly the information that would be helpful to us in terms of helping you. And obviously, we have a just a situation in our school system where they haven't even up-ramped that here in New York. I'm like coming to you here from New York. So I think also, like when you say they'd be able to listen in their bunks, is it like pumped out, or do they have a headset, or do they have, I'm trying to, I guess, visualize how mechanically they're able to.
It's like, they tune into a certain station, like a radio station they're able to listen to what's on the main TV in the day room. So they can either come out into the main area and watch, or they can just listen from anywhere within that housing unit. So it's like a small little headphone situation.
Okay. All right. So I finally got my screen sharing together, and I think, I think we were kind of addressing these questions not necessarily in order. You talked a little bit about the barriers and issues going on. So there's like a private radio they could tune into. It sounds like they're in the works of I guess getting their video visits set up. And I guess with the video visits, that would be like a one-on-one situation. Do you have any idea about how that might operate?
It would be one-on-one at this point. It'll be like little stations that they're setting up. I have not seen it, but I've obviously we're not there yet, but I've heard what has taken place in other facilities that it has completed. So it'll be an individual. They'll have to sign up based on time slots, and then obviously it's going to be sanitized, and then the next person can use it. So it's going to be small increments of time that they'll be able to utilize. So for a group setting, I don't know, to get a full meeting together with multiple people, I'm not sure how we can do that yet, but that's something I'm definitely going to ask and advocate for when that time does come available. I did not mention before that we do have meetings in-house with just the guys. They basically hold their own meetings, and that's happened pre-COVID. That's happened, even when we had volunteers coming in. I supervise a housing unit that used to hold 118 guys. Now it's about 33.
Yeah.
So you can imagine our numbers have been cut significantly. But with that, they recommended, well, actually it's required as a part to live in this recovery dorm to attend at least 2 meetings per week. And they are creative with, you know, coming up with topics or speakers and different things to keep the attention of the group or of the meeting. But that hasn't stopped.
So I'm just wondering, like, how is social distancing currently managed there? Because you were mentioning that they did have meetings before, and I guess whatever's going on with their meals or whatever that is. So I'm trying to visualize if there were opportunities for small meetings to take place. How is social distancing being currently managed, and would they be able to have some kind of small meetings with maybe 10 people or so?
That's exactly the number we went for. I mean, these guys are all living in the same housing unit. So they're already mixed and they're sharing the general spaces.
Yep.
So with keeping that in mind, we were able to have a small section of the dorm, what we call the recovery room. And they do go in there for their meetings. And we did cap it at 10 for social distancing purposes. Before we were able to hold about 17. So now we've definitely reduced that number because of keeping social distancing in mind. And if ever, you know, as I mentioned, the particular dorm is down to 33. If ever they would like to have the whole dorm involved, we can definitely do a meeting in the day room.
Okay. No, that sounds really great. How often do they usually have the meetings?
We have at least 2 or 3 a day. So between morning and afternoon, yeah.
Wow, that's great.
And different topics. So it's not just NA, it's AA, it's chicken soup for the prisoner's soul. It's recovery minded. So, you know, whatever topic they're able to introduce and come up with, where that's something that staff will review and approve if it's appropriate, and then, you know, allow them to gather to do that.
Now, Narcotics Anonymous also has audio versions of our literature. And I'm wondering, do you guys have any access to any of those? And are you still dealing with paper there? Do they have any paper literature, or has that been restricted as well?
No, paper literature is fine. That's pretty much all we've had. We're open.
Yeah.
I'm not sure if it's audio meaning like a CD. You know, technology is very limited for us. We can definitely have a CD. You know, we have the DVD player that can play CDs as well. So that would be awesome for us. Right now, we just use the paper literature. My guys are big into the, let me grab this book. That's the title. It's a STEP workbook. You know, the Narcotics Anonymous STEP Work and Guide, the green and gold book. They love that. I've gotten my hands on a few copies of that. And one of our meetings are dedicated to that.
Yes,
that
Jim.
Jim.
Thank you, Jim.
I need like more copies of that. Like we've ordered a few.
Well, let me make a note of that.
Make a note of that. Now, one of the things that we can do to assist, NA can make available literature, especially those individuals and facilities that deal with people that are incarcerated in one form or another. So there's access, as Wilvina said, to our paper literature. And there's also access, you know, to audios and DVDs, as I think I heard you, if I'm correct, stating that you do have a day room that does have a TV that might actually have a DVD player.
Yeah. Correct.
With that being accessible, it's the coordination of setting that up, because we can get the DVDs and there's multiple DVDs out there being developed that a message can be carried to individuals that don't have access to face-to-face, can't get the computers there to have virtual meetings. So, you know, if we can develop a conduit for communication, because it really is about communication, we can help with resources, but we really do need to know what it is that, you know, are the barriers, you know, and what we can help provide and provide access to.
No, and this sounds great. And I also wanted to take the opportunity, because we have a couple of other people in the room. Jean is also a public relations person from Connecticut. I'm not sure if he wants to introduce himself or ask any questions or just kind of interact with the group. And then I'm wondering if this is the T. Jones that that I'm familiar with from one of our areas here in New York, if you guys want to. Okay, all right, so Jean can't respond right now. T. Jones, do you want to introduce yourself? Okay, he may not. That person may not have audio either. Okay. Okay, T. Jones is without audio. Well, if you want to put any questions or comments in the chat and I can read them out to the group, T. Jones or anyone else, and the same thing for okay. I'm not sure if I'm saying that right. I probably just butchered your name. But this has been extremely helpful, and I also want to encourage you. Next Friday, one of our panelists is going to talk about the program they have in Northern California, where they've got an audio speaker step work series that they pipe out, very similar to what you're talking about, over the loudspeakers into, I think it's a Soledad prison in Northern California. So, you know, that should be a really amazing process. And now that we know that, you know, you guys could certainly avail yourselves of more literature and audio resources, we're going to try to make sure that we get that to you in Connecticut and then follow up with whatever we can do. Now, I also want to mention that here in New York, one of our regions purchased some refurbished iPads and donated them to a facility that has a designated channel on them that that could perhaps be used. So that's also, does that sound like something that that could be accomplished perhaps if we donated some devices that would enable, that could be plugged into the TV, and that would allow a meeting to come in that way, or allow something. What do you think, Ms. Higgins, or
I'm not sure about donations anymore. That would be more with you know.
No, that should be fine. Donations coming from, you know, a reputable site, that's fine. So if that's something you're able to get for us, that would be greatly appreciated.
Yes.
I know that you guys have been in contact with our deputy warden that is in charge of addiction services or addiction treatment throughout the whole state. So that would be the person to send those items to, and then I'm sure she'll distribute them accordingly to the different facilities.
Okay, that sounds great. Okay. So, do we have, let me just put our questions back up and see, you know, if we've covered everything, because, you know, I'm always in the group that's like ahead of schedule. We're doing really good. We're supposed to.
15 minutes.
Yeah, we do. I mean, we could always, let me just see if there's any other thing we could, did you have any questions about any of the other presenters and what they're doing? I guess the other thing too is, I guess in Connecticut, you guys don't really have like mandated probation and parole set up there.
No, we have that.
Mandated though. I'm not sure if I understand.
Well, I know that in other states in the country, and I'm familiar with what they have in New Jersey, they've got a mandated drug court probation program, and I think that's also what they have in California. So when we say mandated, we mean mandated to Narcotics Anonymous meetings.
No, we don't have that at all. It's all volunteer-based here. I mean, probation or parole might require some of their guides, but it's like that's after they've been released from incarceration. For the most part, they'll say, we'd like you to stay connected to treatment while you're out. That'll be one of their stipulations. But it's not something that's usually not something that's ordered by the judge.
Yeah, see, I know in New Jersey, their drug court mandation can go out somewhere between 3 to 5 years, and they have like a designated number of NA meetings that they want them to attend over a period of time, like 3 a week or something to that effect. So, and once again, I think that's a legal stipulation that, is may not be anywhere under your control, but I think the idea of just hearing what's available is.
I think we've had guys over the years and gals that would come in and need executive slip signed to bring back to the court, whether they're still incarcerated or in the parole part of their sentence.
And I also write to parole on if they're participating in group. I'll tell them when they're starting and if they finished, how many they've missed.
But that's more for programming, not meeting purposes.
No, but
So Adam, who just came back on, is our point person for public relations in Connecticut. Let me just sum up with him a little bit about what was said. Basically, they mentioned that they could absolutely use more step working guides, more paper literature, that they would be able to avail themselves if we have an audio basic text version. They said that at this point they are having meetings with about 10 people that are socially distant. They have about a variety of 2 or 3 different recovery meetings per day, but that they would also be able to utilize the TV in the day room to put any videos that were pre-recorded from any speaker jams or prison presentations. And then they also said that they'd be willing to take donations of iPads that were set up that could perhaps have Zoom capability. So that's something, we could talk about doing. That's actually amazing news to hear that.
Yeah, that is amazing news. Yeah, sorry, I had a family issue that I had to go deal with real quickly. No, that's great news. Thank you for summing that all up. So we'll definitely make note of all that. And hopefully, again, I know I heard Wilvina say it earlier, Mark is our hospitals and institutions chair, and him and I are working together to try to take care of all these issues and try to get Narcotics Anonymous back into the facilities. So your input is greatly valued.
I talk to Mark quite frequently.
Oh, good.
Email and stuff, occasionally maybe once a month phone call.
Yep.
I'm actually was surprised that he's not here.
He's in a different breakout room.
Okay.
Yep.
Yeah, he's very helpful to me.
Oh, we love to hear that. And I guess I'm hoping that for the people who are attending that don't have audio capability, if there's anything you want to put in the chat, any I guess anecdotes about anything that went on. We did talk about challenges, anything that you want to bring to our attention that might make it easier. I'm kind of curious too about your ability to store literature and things of that nature, like if we got that to you and how much you could actually take, get there if we were able to get literature to you. How is that managed to maintain there?
I usually take the books with me when we had the actual meetings, and I would bring literature. I would bring the cardboard key tags that Mark implemented, and they were all with me at the group.
We usually bring a little crate with with our material to bring to the group room. But as far as storage, we have a number of file cabinets we could put something in for them to be utilized where we know the meeting will be held at.
Do they keep that literature with them at all, or you like you
That's
give
what
it
I was
out and
about to
take it
ask.
back? Yeah.
Like we have our step working guide, we have those things within the dorm so they can pull it at any time. So there's a few things we keep within the housing units, and there's a few, like to replenish them, we'll have our staff supply that we can then trade them out when one maybe disappears, hopefully for good reasons, or it gets worn and needs to be replaced.
What about the basic texts at all? Are those around?
Yep, I have like 20, 25 copies. Actually, Mark just brought me in right before the COVID started.
Yeah, I was going to say there should be a lot of basic texts.
Yes.
Yeah.
Yeah, they
We
get
have a-
donated from our East Coast convention, actually.
But like the paper pamphlets, we use them all the time.
They come and go.
Yeah.
Well, that's good. It's good that they go.
And the blue book, if they ask me, I give them one.
Okay. And they get to keep that, the blue book.
Yes.
Yeah.
Yep.
Okay.
If they have any questions, I always say, come see me. We'll talk about it.
Good to know.
Now, I'm wondering about sponsorship there. Do you know if do they have like a sponsorship program? I mean, I know you said you guys have, there's someone that holds like regular NA meetings there. Do you know?
We do. We have Writing Steps for Recovery.
Yep.
And that's been utilized a lot. And it's out of Middletown.
Yeah, it's actually in our whole region. The post office box is in Middletown, yeah.
Sorry. Yeah, they utilize that a lot.
Okay.
That's great.
So let me ask this question. Your Deputy Warden Violet, she's pretty much the point person for any of these other initiatives. Like, let's say we were able to get the iPad donation system set up. She would be the one that would kind of administer any of those things going forward.
Yeah, she'll be the one to definitely approve it and work with the facilities, because each warden at a facility can, pretty much set the tone, like in terms of what they'll allow within inside the facility. So she'll be the one to advocate for it if need be, and to get the wardens to buy in to have some of those materials. I'm a council supervisor here at Willard Cybulski, but there's a council supervisor in every facility that for our unit.
Right.
She'll be the one that that's our supervisor to be able to advocate for those programs or those resources.
And then I noticed you guys have a lot of chaplains. A lot of the chaplains signed up, and I'm wondering about, I guess, like the role of the chaplains. Do they set programs up, or is it just through the deputy warden, or?
It's facility specific. Like I knew Sister Geraldine, who was on the call. She works at the Hartford Correctional, and having worked there myself for a period of time, she was more involved, there. At this facility, we don't have the involvement from our chaplains. It's pretty much specific to just religious services. And as addiction counselors, we're the ones who are coordinating the fellowship meetings for us. So it's facility specific. It's just different cultures, different places. Yeah.
Right.
I mean,
right.
I have contact with all the chaplains and deacons, and I contact the Native American guy, the Muslim guy, Catholic, and
Protestant services, yeah.
Yeah.
So we're in contact, but as far as,
them being involved in group, no.
yeah.
Well, I also want to say what an amazing job you professionals are doing in Connecticut. We are so thrilled of the, overwhelming participation and, registration turnout. And we're just so excited about your involvement here. And especially it's conversations like these that once this conference is over, we can actually make this kind of information available to the other prisons, up and down the Northeast. we had some reach out to Maine and Massachusetts. We also had a couple of people attending from, the New York State Department of Corrections. We're just getting the 5-minute warning here. So Connecticut really in this virtual aspect is really leading the way. And I want to just also really acknowledge Adam and Mark for that, because once we're able to put all of this together into a package, other people that weren't able to make it will be able to hear how your prison community is addressing these challenges right now.
Cool.
Yeah, this is a good opportunity. I've worked within the field within this particular in corrections for 13 plus years, and this is the first one that I can recall. So I think that continuing these would be awesome. I wish wish I had mandated the rest of my staff to come here. So if this becomes a thing again, I will definitely have my entire team be a part of it. I think it's important.
Well, they've got, next Friday.
Exactly. Again,
I know as LaRue had mentioned when we first started today, we were working back in February about doing something like this in person and trying to get as many of the addictions counselors as possible to attend, and probation officers, and then of course the pandemic hit and everything got shut down, and so we sort of pivoted and decided, well, we can do this virtually. Took a little bit longer to get it going, but here we are. So.
Okay. I think we've got like 2 minutes before we go back to the other session. So, would you guys mind if I did the summary to the whole group?
No.
I think that's good.
Okay. All right. So listen, just to leave, there's like a little blue button on the bottom right that says leave room, and then at that point you'll be able to go back into the main session, so you won't just kind of be hanging out here when everyone else is back to the main session. And then we're going to sum up, and we're going to get a chance to hear what all the other breakout groups discussed. And then if you have any final questions or comments, we should have a couple of moments to do that. So
just so you know, Wobina, I posted your email in the chat so that if any questions were unanswered and you're looking for more information, they can reach out to you via your email so you can help connect them with their local region, area, PR, or H&I committee. So that is in the chat.
Yeah, well, Adam also put yours as well. Adam is the point person for Connecticut Region, public relations, and working very closely with Mark and all of us in the zone. I do want to mention Jim is the public relations chair for Western New York, and that our zone has 12 regions in it that spanned all the way from Maine down to the middle of Virginia, and we meet monthly to discuss reopening challenges with COVID, to share everything else that's going on. And this project was really something that all of the other PR chairs from New York, New Jersey, Connecticut, and the other regions, and even outside of our zone. We have people from the southern zone, Florida, Tennessee, Texas, and obviously California that have participated. So, okay, we've got a 1-minute warning to go back.
Yep.
And I'll see you guys in the main session. Thank you so much, everybody.
Yeah, thank you very much.
Thank you. Much gratitude.
Bye.
I said bye, but
You're a fidgeter, aren't you?
I think I